This is going to be a presentation over visual fields and depth perception by Ashley Fitzpatrick and Mario Parra. We'll start with visual field screening. The objectives is to have knowledge about what kind of patients to use the visual field screening on, knowledge on how to perform the visual field screening, and be able to apply the information given and perform the screening test yourselves. What kind of patients would we use the screening test on? We would use this with patients that have glaucoma, retinitis pigmentosa, which is chronic hereditary eye disease, characterized by black pigmentation and gradual degeneration of the retina. We would also use this with patients who have had strokes, brain tumors, or traumatic brain injury, as well as age-related macular degeneration, which is deterioration or breakdown of the eye's macula, and the macula is part of the retina that is responsible for your central vision, allowing you to see fine details clearly. Why would we perform the visual field testing? This test tests the peripheral vision and central vision. Central vision is when our eyes focus straight ahead, and peripheral vision is part of vision that occurs outside the very center of gaze, so your side vision. Some functional uses for central vision is driving, reading, grocery shopping, being able to see faces and distinguish detail. And some examples for peripheral vision is going to be able to see someone walking up beside or behind you, a ball flying in the air when playing specific sports, and a car swerving in your lane while driving. The normal field of vision is approximately 160 degrees using both of your eyes, and for one eye it is going to be 60 degrees superiorly, 75 degrees inferiorly, 60 degrees nasally, and 100 degrees temporally. Visual fields are screened in the vertical and horizontal planes and in the 4 quadrants: superior, inferior, right, and left. When the patient is looking straight ahead, an object located directly in front of the patient is considered to be at 0 degrees. An object located directly over the patient's head is at 90 degrees, and an object located directly out from the patient's ear is also going to be 90 degrees. Here are the instructions that involve the visual field test. You would want to be in a well-lit room, and you're going to place the patient in a seated position. Sit opposite the patient at approximately 1 meter. Cover the patient's right eye with an eye patch, or simply use their hand to cover their eye. Instruct the patient to look directly ahead, focusing on your nose. Place both of your arms behind the patient's head, out of the patient's field of view. As the patient looks directly ahead, move the visual stimulus in the horizontal plane from the 90-degree position to the 0-degree position, and instruct the patient to verbally indicate using a yes or there when he or she first sees the visual stimulus. Document the position along the plane at which the patient first indicated vision of the stimulus. You're going to repeat this procedure in the vertical plane and then repeat it again with the left eye covered up. This is going to be a short video of an example of the visual field screening. Okay, I'm going to perform the visual field screening test, and for this one we're going to go inferiorly, superiorly, temporally, which is going to be opposite of the side she's covering her eye on, and this one is going to be nasally, which will be the side she's covering her eye on. And for the first time you can use a goniometer to measure the degrees, but you can also, this is considered 90 degrees straight outside, and this is considered 0 degrees. So if you're doing temporally, you can just this is 90, and the normal degree is 100 degrees, so you can pinpoint going back to 10 degrees from there. And then you tell them just focus straight ahead, so you're going to focus on my nose and cover your right eye, and just let me know when you see it. There. Okay. This is going to be superiorly. There. This is going to be temporally. There. And this is going to be nasally. There. Okay, and then your left eye. And you just do the same thing, so tell me when you see it. There. Superiorly. There. This is going to be temporally. There. And this is going to be nasally.
Okay, so now we're going to talk about depth perception screening. So here, as you can see, you cannot have depth perception if your eyes are closed. We need both of our good working eyes to achieve depth perception. Okay, our objectives are going to be to understand depth perception, knowledge of the causes of depth perception dysfunction, and to be able to apply the information and perform the screening test. What is depth perception? The ability to determine whether objects in the environment are either near or far in relation to each other and in relation to self. So before I go on to talking about depth perception dysfunction, I want to explain how exactly we can obtain depth perception. So we obtain depth perception through stereopsis or stereovision, which is vision wherein two separate images from two eyes are successfully combined into one three-dimensional image in the brain. So in the picture you can see both of our eyes, our left and our right, and we were going to look at one image and kind of get the angle of both images and put it into one. So I like this picture a lot better because I feel like it portrays the information a lot better. So if you have the dies right here, our left view is going to get this aspect and our right view is going to get this aspect. So then the information is going to be sent up to our brain, and at the same time, when it arrives, it's going to be combined into one image. So it's going to combine information from the left and the right, so what they have in similar, and it also is going to add what they have different. And that will make up the three-dimensional figure, which is going to be stereo vision. Okay. So if you have good stereopsis, you're going to have good depth perception. And this is going to help us to see in 3D, to see where objects are in relation to our own bodies and to other objects with much greater precision. It's going to help us see when objects are coming towards us or away from us. It helps us see a little bit around solid objects without moving our heads. And it helps us perceive and measure empty space with our eyes and brains. So these are a couple of examples of occupation where you're going to need stereo vision. You practically need stereo vision for other occupations other than these, but I wanted to give you examples that depended on heavily. So a baseball player, a waitress, a driver, an architect, a surgeon, or a dentist all heavily depend on stereo vision. And these are examples of general actions that depend heavily on stereo vision: throwing, catching, or hitting a ball, driving and parking a car, playing and building a three-dimensional object, threading a needle, pouring into a container, or stepping off a curb or step. Okay, so how does depth perception dysfunction impact an individually? It really impacts your every activity on daily life because you need to see how far objects are or how close they are or if they're coming to you. So it would impact your ADLs. If you're trying to eat, it'll be kind of hard if you can't really see where the food is. Safety is compromised. Actually, a lot of falls are caused because of depth perception in the elderly. IADLs, preparing a meal will be rather difficult. Childs trying to learn are going to also have difficulty performing normal tasks, and also finding a job will be pretty difficult. A lot of companies don't really receive people with bad depth perception or with only one eye, so it would be hard for somebody to find a job. Okay, the causes of poor depth perception are blurred vision, typically in one eye, and a lot of the times if you have difference, like great difference in one eye and the other, you're gonna have some depth perception issues. Cranial nerve palsy, which is partial or full paralysis of the third, fourth, or sixth cranial nerves. Strabismus, which is misalignment of the eyes. Anophthalmos, which is the absence of one or both eyes. It may be congenital due to trauma infection or other causes. And amblyopia, which is lazy eye. Okay, so now I'm going to guide you through how to screen for depth perception dysfunction, and these are just short steps so you can get an idea, and we'll follow up with a video. So number one, you're gonna be in a well-lit room. Place several different size blocks on a table in front of the patient. Ask patient to identify which block is farthest away, which is closest, and which one is at mid-range. You can also place the patient in front of a window and ask him to identify which one is closest, farthest, and at mid-range. So here's a quick video on screening.
Okay, so I'm going to show you guys how to do a simple depth perception screening. You can either be at the patient's home or at a clinic. If you're at a clinic, use any 3 objects that you can find there, or if you're at home, try to find 3 objects that are familiar to the subject. So I have an apple, an orange or a mandarin, and a chocolate. And then you're going to place them in a straight line. It doesn't have to be biggest to smallest. It can be any order. Make sure they can see the objects. And then you're going to ask the following question. So, are you able to tell me which object is farthest away? Green apple. Green apple. And if they can't speak, you will just ask them to point. Okay, now we'll switch them. Can you tell me which object is closest? Green apple. Green apple. And then we'll switch them again. Can you tell me which object is in the middle between the farthest and the closest? The chocolate. Okay, good. So obviously she didn't have any depth perception dysfunction, but if she did, she wouldn't be able to accurately tell you which one's farthest, which one's closest, and which was in between. And as I mentioned before, you can also do it if there's a window. You can ask them which object is farthest, which is closest, and which one is in between. So whichever just works for you, depending on the environment that you're in. But that's it. It's super quick.
Okay. So I hope by the end of this video we helped you guys to understand a little bit more about what visual fields are, as well as depth perception, and what individuals are going to need screening and how to screen for it. Thank you for listening.